Let's get you updated now on COVID-19 here in Arizona. Another 600 people tested positive in our state, bringing our total number of COVID-19 cases through this pandemic now past the 200,000 mark. Another 33 Arizonans sadly have been reported as dying from complications due to COVID-19. That total number, 4,929 Arizonans. Our average positivity rates continuing to decline. That's good news, with the 7-day rolling average from Johns Hopkins University at 7% and the weekly average coming from the Department of Health Services at 6%. This, as we are on the cusp of maybe making some major changes across our communities and opening up some of the businesses that have been closed due to the executive order. So joining us this morning is the director of the Arizona Department of Health Services, Dr. Cara Christ. Dr. Christ, thank you so much for your time. We know that you are incredibly busy right now. Let's begin with what appears to be some very good news about those rolling averages, and we're approaching a new benchmark, correct?
So today we will be approaching a new benchmark in several of our counties. 8 of our counties are going to move into the moderate range, and one of our counties is actually going to move into the minimal range. So we are very excited that Arizonans are doing everything they can to prevent the transmission of coronavirus, and we really need to keep it up.
How will this impact specifically Maricopa County, and what are the trends that you're seeing here as we've seen, say, for example, ASU go back to school? I know there's about 160 cases of COVID-19 so far tested in students and staff there on campus.
So Maricopa County today is moving into the moderate range. And what that means is that businesses that were limited by Executive Order 2020-43 will be able to open with reduced capacity and stringent requirements in place, which are COVID prevention strategies. And so they'll be able to open just by going on our website, attesting that they will follow those stringent requirements. And then they will be able to operate at whatever reduced capacity is prescribed for their business type.
And that's definitely happening. That's today or tomorrow?
So that's happening today at 9 o'clock, our dashboard updates. And so people will be able to go on and check and see where their counties are. We are also, as we continue to move forward, Maricopa County is trending in the right direction. That makes the state trend in the right direction because of the large population in Maricopa County. We will see how different things such as the businesses opening up, schools going back in with ASU and the University of Arizona. Our benchmarks are built so that if we move back up and our metrics tend to go back into the substantial, our business owners have requirements that they need to meet if we do go back into that category.
Dr. Christ, how do we stand with Operation Catapult, and what are your comments about these new guidelines coming from the CDC? Essentially seems to be counter to what we've been told throughout this pandemic, which is suggesting that you be tested if you know you've been exposed to somebody who has COVID-19. Therefore, you can find out if you have it and prevent yourself from spreading it to somebody else.
So Arizona has done really well at increasing the capacity, and our labs now have a current turnaround time of about 24 to 48 hours, depending on the lab. Sonora Quest does the majority of our labs in Arizona, so they have less than a 48-hour turnaround time at this point. What we would encourage in Arizona, the CDC speaks for the entire nation, and so there are areas that still have capacity issues or access to testing barriers. Arizona has worked very hard, and we continue to increase access to testing and our turnaround times. And so we encourage all Arizonans who believe that they've been exposed to or infected with COVID-19 to go get a test, and you can find a testing location near your home at azhealth.gov.
Thank you so much for clarifying that. I want to talk a little bit about back to school. I know there's been just so much emotion, so much conflict, and really confusion district by district as to how to roll out on-campus learning in these hybrid systems or full capacity. So what will be, is there going to be any kind of protocol for reporting cases that happen on campus when the kids go back to school? And what would be the follow-through that would be recommended from your department?
So we have the benchmarks in place for schools. Right now, many counties don't meet those benchmarks to go back to schools, but they're really recommendations because our local public health departments and our school districts know their communities the best. So they have to have a mitigation plan that they post on their website about what they're going to do about making sure kids aren't sick, that they're cohorting, that they're requiring masks, and that they're physically distancing. Schools now, based on an emergency measure we signed this week, are required to report outbreaks, which are two unrelated cases of COVID or more that occur at the school that don't have any other outside contacts. And so we will be working with the schools. They need to report that to their local county health departments. They are very used to reporting outbreaks because they report a number of different diseases, such as measles and mumps and chickenpox, if they have an outbreak at their school. Our local county health departments, who are our experts in our communities, will be the ones to provide technical assistance about what to do with the kids, who needs to be quarantined, do classrooms need to be shut down, but it will be done on a school by school and case by case basis.
Dr. Cara Christ, thank you so much, and nice to hear some positive news about, obviously, our members of the community have been acting responsibly, so I imagine as we wrap up, you want to remind us to continue to do so. Those behaviors are working.
Yes, so we encourage, while we're heading in the right direction, we're not out of the woods. Coronavirus is still in our community. We expect it to be in our community for a while. So please continue to wear masks, physically distance, and stay home when you're sick.